You are welcome to my channel. This is an excerpt from the full presentation on atrial fibrillation. The link to the full presentation on atrial fibrillation is this very one. You can copy and paste. Enjoy listening. Thank you. Okay. Looking at the art from the outside, you get details when you follow the link already provided. The heart. We will understand this subject better when we go through this very slide thoroughly. Okay, so don't be in a haste. You can see that we've opened up the heart, right? And we can see what is happening inside, because that is where the problem is. To start with, the journey of 1,000 miles will start with a step, right? This is the inferior vena cava, bringing used blood, deoxygenated blood, from the lower parts of the body. This is superior vena cava, bringing used blood, deoxygenated blood, from upper parts of the body. They will both empty into this right upper chamber called right atrium. At the junction of the superior vena cava and the right atrium is the sinoatrial node, the heart pacemaker. Let me go through the pumping activities first, and then I'll come back to the electrical activities. When the blood is here, what is expected is that it's going to pump. This chamber will pump the blood into the right ventricle. The right ventricle is expected to pump the blood into the pulmonary artery. It is called pulmonary because it's going to the lungs, and it's called artery because it's taking blood away from the heart to the lung. Inside the lung, we know what is going to happen. Oxygenation, right? The oxygenated blood, not deoxygenated, oxygenated blood will come from the lungs into the heart on the left. This is the left atrium. And any vessel bringing blood back to the heart is a vein. So pulmonary vein from the lungs will bring oxygenated blood to left atrium. It will not just be sitting down there. It will be pumped into the left ventricle. The left ventricle will pump the blood into the aorta through aortic valve. Some people will have aortic stenosis, and they will come down with certain signs and symptoms, fainting, syncope, falling. No, that will be for another day. Okay. Then from there to the ascending aorta to arch of the aorta. These ones will supply the head and neck region, and then descending aorta, and then abdominal aorta, and so on. You could see that the ventricle is thicker compared to the atria. See the left atrium, the right atrium, see the wall. Okay. Now, as per the electrical activity, what is the issue? The sinoatrial node is expected to generate the impulse, the electrical impulse. But in atrial fibrillation, we have a problem. The normal sinoatrial node activity here has been overpowered by aberrant foci all around. And then instead of the action potential that will lead to depolarization here, that will give us good pumping force that will push the blood into the ventricle, there will be quivering. Instead of one strong squeeze that will force the blood here, we'll see many quivering, just fibrillating, quivering. It's not really, having enough force to contract in a strong way to pump the blood into the ventricle. So with that, the heart will fail because enough will not get to the ventricle, enough is not getting out. The same thing on the left, the blood is here, enough is not getting into the left ventricle, enough is not getting to the aorta. So that's why we'll be dealing with heart failure. Remember also, when the blood has been dumped here in the right atrium and it's just there for a long period of time, remember clotting factors are also included, platelets are there, then clot formation will occur. And remember, when clots are formed here, and later on part of it is taken into the lungs, we'll have problem like pulmonary embolism can occur. And if the clot is coming from the left side into the aorta, that will give us stroke, right? Remember, this ones I said will go up to the neck and the head, that is the brain, okay? So we have seen that atrial fibrillation is a serious matter because it's going to reduce the activity, the force, the efficiency of both right atrium and left atrium, giving us atria. Two of them is atria. That is why the name atria. And the name fibrillation means instead of full contraction that will pump the blood to the right ventricle here and the left ventricle here, is just going to be quivering or fibrillating. So we can now see fully how we can run into trouble with atrial fibrillation when the sinoatrial node is being overpowered by the unwanted foci around. We've seen the heart again. We've just gone through chart 2 and chart 2, DS2, VASC, risk determination of stroke in AFib, right? Remember this. Remember the explanation already given, just in a bit. Remember that when the blood is dumped here from superior vena cava and inferior vena cava, and instead of full contraction that will force the blood into the right ventricle and take it to the pulmonary artery and to the lungs, that's not happening in atrial fibrillation. Instead, there's quivering and fibrillation right here, meaning less blood will be pumped into the ventricle, more will stay here. With the platelet aggregation and other clotting factors, then clot formation will occur. And when that breaks and comes here, and then that is pumped out. Okay, the same here, and whatever clot is formed here would then be pumped into the aorta and then to the brain. That is how the stroke will occur. Yes, we've gone through how atrial fibrillation could lead to stroke, right? But let's enjoy this picture together and then refresh our memory. Superior vena cava is bringing blood from upper parts of the body, inferior vena cava from lower parts of the body, down in the right atrium. Normally, sinoatrial node would generate the electrical impulse leading to depolarization of the atrium and then pushing the blood into the ventricle respectively. But in atrial fibrillation, there's quivering or fibrillation, not full contraction. So loss of the blood will still be here. Stasis is occurring. And remember, we are talking about whole blood now, where platelets are present and other clotting factors, right? Then clot formation will occur. And with that, if it's happening here, to pump from here to the ventricle and break and then get into the blood, and then is pumped by the left ventricle through the aortic valve to the aorta, and this will supply the head and neck region, then the individual comes down with ischemic stroke. Also from here, lead to pulmonary embolism. Okay, the heart failure issue with atrial fibrillation. Okay, let's study it together. We've gone through this animation and the stroke, right? Okay, the heart failure now. The blood is coming from inferior vena cava, superior vena cava into the right atrium. Enough is not pumped because it is quivering instead of pumping. Then there is stasis. So enough is not getting to the right ventricle, less is pumped by the right ventricle to the pulmonary artery, less is going to the lungs. Okay, whatever is coming from the pulmonary vein to the left atrium is staying here. Okay, instead of contracting fully and pumping the blood to the left ventricle, just a little bit is going to the left ventricle. And it is that little bit that is going to the left ventricle that will go through the aortic valve into the aorta and to the entire body. So the heart is not sending enough to the entire body, so the heart is failing. The heart is failing, there's stasis here, there's stasis here. The stasis here will lead to backflow to where the blood has come from. So there's edema down here, pedal edema. Then here, there will be cough because there will be pulmonary congestion. That's why we use LASIS in congestive cardiac failure. There will be pulmonary congestion, then autopnea, paroxysmal notional dyspnea, because when they lie flat, the lung is congested, the person is coughing and coughing. Okay, then swelling fades because it's the enough that is reaching here is not getting out, so it's going back. And the same, there'll be swollen face, and eyelid edema or periorbital edema and so on. So you can see some that we have hemoptysis, the congestion here, going back to the lungs is responsible. In the heart, one atrium, two of them form atria. We have two ventricles, pulmonary vessels, the aorta. There will be abnormal rapid chaotic heart rate occurring in the atria, but the ventricle was a response. There will be irregular rhythm here. There will be inadequate pumping function of the heart, leading to heart failure. There will be stasis with a tendency to form clots and subsequently stroke. I have a rough sketch here. This P wave KRS complex. This is P wave, giving us the indication about atrial depolarization. The KRS complex is ventricular depolarization. Now the PR segment, the PR interval. For details, you can click on this very link. You get further, piece of info on that. Okay, you can see this, and then this is EKG of an individual with atrial fibrillation. It is irregular. The same here. Because of copyright issues, I cannot get more than this for now. But when you study this, this is irregular. You can trace it out. Thanks for listening. Please click on the link for full pieces of info on atrial fibrillation. It's 1 hour plus presentation. Thank you.